Now, we are doing another group of exercises. These are wonderful. These are the forward bending exercises, the abdominal exercises. People love it because their belly will be improving. So now, always you're in this comfortable crisscross position and put your foot forward, the left foot touching the right thigh. You can start this way or that way, but now try to touch your hands to the feet. Breathe out, forehead to the knee, and like this. Ideally, this should not bend. That's what the yoga dictates. But in my system, no. You can do whatever you can. Breathe out and stay like this for some time. Nice normal breathing. Once you breathe out and then normal breathing. Again, see, I cannot even touch the hands at the feet, hands touching the feet. I cannot even do it perfectly. I've been doing it for 35 years. The Absolute Yoga has a different way of dealing with these stretching exercises. So, bend like this and breathe out and do the normal breathing if you want to. You can do like this and then come straight. Breathe in, breathe out, breathe in. You can try to touch the forehead to the knee like this or even like this. Whichever way is comfortable. Ideally, people touch the forehead to the knee. Now, the 3 times up and down. So now the left leg straight, right foot touching the inner thigh. Now, breathe out. See how I cannot even do it. This is the best I can do. Breathe in. Breathe out. Breathe in. Breathe out. You can stay like that. Nicely relax. Do the normal breathing. This forward bending is a great boon because this is the normal fetal pose. The fetus in the mother's womb stays for 9 months like this in the pose. It's the best secure pose. It will not damage your back. So 3 times. You can do the dynamic motion like this or just do like that. So now that ends one set of exercises. Ready for the next exercises. Same thing, the forward bending. So in order to relax your feet and legs, do this forward and backward. The ankles, forward and backward. You can do it slowly, doesn't have to be fast. And then rotate it clockwise and counterclockwise. Nicely, up and down. Suddenly, sometimes you might have a strain or a sprain in that joint. Don't press too much. If it's kind of too hard, just leave it alone. And sometimes you have to even just ignore this exercise and do something else. But if you slightly push and do those things, you will be able to overcome that blockade. So depending on your comfort zone, do it. Once you become more and more comfortable with these exercises, you will know how to control your body. So now we freed these movements. Now the same exercises, the forward bending exercises, the left foot on the right thigh. So you can pull it. Do not worry. Don't worry about this joint. Everything will be okay. The joints are not able to, you cannot pull it out. You can only strain or sprain a muscle, but that will become normal again in a week. So, forward bending, breathe out. Forehead trying to touch the knee, hands trying to touch the foot. Breathe out. Once you breathe out, once you come to this position, you can nicely relax. You can actually go to sleep. Nicely relax. This one posture, these forward bending exercises, I would encourage you to do the static pose. And then do the dynamic pose. After slowly, but do the maximum possible for you. And now, the left leg straight, right leg try to put in on the left thigh. Look at my right knee is not as comfortable as the left knee, but still I'm trying to do my best. So pull it and then try to do this. Forward bending. This is because I had a joint injury 2 decades ago. It was painful for a year, but everything is normal now. Occasionally slight pains, but doesn't matter. You have to learn to ignore it. If you don't learn to ignore the small pains, you will be in trouble for the bigger ones. So that's the principle of absolute yoga. Ignore the negativity. Focus on the positive. Your joint is wonderful, healthy, and you can do it for the rest of your life. You can use that. You don't have to get a false joint so soon. Mark my words, you can use these joints for 100 years. So forward bending, breathe normally. Even if it's painful, just stay like that. Nothing is going to get dislocated. And then you can do the dynamic pose. And get back to this if you want to make it comfortable. That ends that group of exercises. Ready for the next exercise. Cross the legs. Now take your right foot and get it close to the left ear. Breathe out and wait there. Even if it's painful, do not worry. Tolerate it. And then put back, forward bending. Stay like that. Take the foot again. See, I cannot even put this to the ear. 25 years ago I was able to do it, but I changed my idea about the yoga itself. Yoga is not about perfect bending. It's about balance again. So, do this one 3 times. Breathe out. The ideal thing is forehead touching the knee, hands touching the feet. Nice posture, no bent like that. But I'm nowhere close to that. But still, I feel this is the best. So, do the 3 times here. Now, the opposite. See, I can do this joint slightly more freely and pull it to the ear better than this joint. But that's okay. I'm not into trying to make this perfect. This is good enough for me. Breathe out, breathe in, and breathe out again. Always breathe out when you bend forward. The abdomen bends, it goes inside, breathe out, and the air is expelled. That is the yogic breathing. When you breathe out, abdomen goes in and air is expelled. And once you are in the final posture, you can do the normal breathing. Again, pull it. And then So those 3 times over. Now we're doing the forward bending exercises. Now feet together. If you want to relax the ankles, one more time. Nicely rotate forward, backward. So make it flexible. Now feet together. Breathe out and try to touch the forehead to the knees, hands to the feet. So whenever you bend forward, abdominal breathing. Air goes out, abdominal wall goes in, and then the forward bending becomes easier. And that's the standard procedure for the yogic poses. Forward bending, you can stay like that and nicely relax. Breathe in, breathe out. If you have muscle cramp, adjust it. 3 times. The ideal final pose is forehead to the knees, hands touching the feet. Now, 1 foot apart, 2 legs, 1 foot apart, forward bending. Breathe out, abdominal wall goes in, and you can stay there. Breathe in, breathe out. Breathe in, breathe out. So 3 times. And wider. The widest possible you can push it. Breathe out. Air goes out. Abdominal wall goes in. Forehead trying to touch the ground. Hands trying to touch the ground. 3 times. Breathe in, breathe out. Breathe in, breathe out. So basically you can do that and stay in that posture as long as you want to. And then come back to the normal pose. So the final exercise, after the completely widening, the final exercise, feet together. So put it together, draw it towards the hip, and do the butterfly, like the hips stretching out and the legs doing the butterfly motion, and then forward bending. Breathe out and try to touch the forehead to the feet. Breathe in, breathe out, breathe in. 3 times. You can stay there if you want to. You can nicely stay there and keep on nicely stretching forward. That ends the forward bending exercises. Want to just kind of stretch out the feet and make it comfortable. And then those are the group of exercises for the forward bending. We are done with that.